Hello, welcome. Come on in. We're going to give it just another minute or two here to give people time to transition on in, and then we'll get started. All right. Well, welcome everyone. Thank you for joining today's training on a behavioral health toolkit brought to you by the Employee and Retiree Benefits Division of the Washington State Healthcare Authority. This training is intended for wellness coordinators, HR professionals, and anyone else who may hold a role related to benefits, mental health support, or employee well-being at your organization. So today's training will cover the following topics: an introduction, talking about how this initiative came to be, a bit about the process behind the scenes, and the intended outcomes we'll be watching for. The toolkit components, which include a behavioral health benefits FAQ, glossary of terms, and poster. How to use the toolkit, including how to access it and how to use the different components in different roles. And then finally, we'll spare a few minutes for any questions you may have. I want to note here that, as you'll learn in the upcoming slides, this was a collaborative effort between multiple divisions in the Healthcare Authority, and some questions may not be able to be answered live for quality control. In this case, we're happy to take down contact information and follow up with you individually. So a bit of background into this project. We'll start by talking about Brennan's Law. Some of you may be familiar with this, but essentially Brennan's Law was signed by Governor Inslee in 2019. And among other things, this law establishes requirements for health providers, health carriers, to prominently feature behavioral health coverage in an easily understandable format. It does not, however, create requirements for the employers who offer health insurance benefits. So those of you who work in benefits know that health carrier information that's provided does not always or often effectively reach insured or potential members. So we here have the opportunity to bridge the gap to significantly impact members' understanding and use of behavioral health benefits through benefit education. So a bit of the process now. A work group was formed with members of DBHR, the Division of Behavioral Health and Recovery, ERB-COMS, which is the Employee and Retiree Benefits Communications, and Washington Wellness, to help kind of bridge this gap between the carrier provided information and what reaches our members in an understandable way. We collectively chose a number of objectives covering things like ease of access, plain language, and compliance, as well as a few measures of success to keep track of. We also considered existing materials and resources to avoid duplication of efforts, and strategically chose a few items within our scope. Then we got to work creating new materials and preparing to update existing materials. More on that in the next slide. The big picture goal of this project was to make health information regarding behavioral health benefits in the PEB and SEB programs more easily accessible and easier to digest, so that PEB and SEB program members can make informed decisions regarding their plan selections and benefit utilizations, as well as increasing their level of confidence when they go to use those behavioral health benefits. So the three items we identified as being within our collective scope, feasible within the identified time frame, and helpful to our wellness coordinators, benefit administrators, and our member population were a behavioral health benefits frequently asked questions sheet, a glossary of common behavioral health terminology, and a poster to increase visibility and raise awareness of the many existing behavioral health benefits already offered through our PEB and SEB health carriers. So let's take a look at each one of these. So on the frequently asked questions, information here generally falls into three categories: Get Help Now, Behavioral Health Laws, and Behavioral Health Services. Now these are compiled from a broad population of professionals, individuals supporting loved ones, and people experiencing mental health struggles themselves. So you may find that these FAQs are most helpful when broken up and shared in different contexts. Thankfully, mental health initiatives from many different organizations are starting to raise awareness on what to do if you or a loved one have a mental health emergency. We've started to move the needle there, but we always want to keep that information front and center. So you'll see that listed at the top, as well as a link to the Healthcare Authority's Mental Health Crisis Lines webpage. The second category is behavioral health laws. Knowing laws as they relate to behavioral health is important for a few reasons. One is understanding why things happen the way that they do, why information is shared or not shared during the course of care, or it's also important to know in the case that you feel a provider is not compliant with state law. You need to be able to back up your requests, essentially. So behavioral health services gets into the practical information regarding how to get behavioral health support, where to start if you're on square one, what to do if your current care plan isn't working for you or not effective enough, alternative or supporting care options, and using your insurance to get naloxone or Narcan. Now the glossary. Insurance can already feel like its own sort of language, especially for those that don't regularly spend time in the weeds of benefits. But when we layer behavioral health language on top of that, for people who are already struggling, not understanding the terminology can be a very frustrating barrier. This glossary was carefully crafted in plain language to be understandable to the general population while still maintaining the integrity and accuracy of information. This is by no means an exhaustive list, but hopefully covers some common terms and acronyms that may be used by providers or insurance carriers that are not well understood by the general population. And finally, the poster. This one is pretty self-explanatory. We really just wanted something easily visible to catch employees' attention and direct them to review the behavioral health benefits available to them. This poster includes a QR code directing employees to the behavioral health benefits by plan page, which, if you're not familiar, is a really helpful resource for people who may be in need of behavioral health support but struggling to know where to start, maybe experiencing longer wait times than they expected, or looking for options outside of traditional talk therapy. An important shift I believe we still need to make as a society is not waiting until we're in crisis mode to seek help. And making use of the benefits already paid for through your insurance plan is a really easy foot in the door to start caring for your mental health before you reach the level of a crisis. So please use these. They are here for you, and we want you to take advantage of them. Really engage and dive in and take care again of your mental health before you find yourself really struggling. And now, how to use the toolkit. It's also our hope that it would be pretty self-evident how you should use this toolkit, but we do want to highlight that the usage may be a bit different depending on your specific role. So for accessing the toolkit, I provided links in the chat during this presentation, not links, but files that you can download. We're also going to compile this into a combined PDF, and that will be posted on our website. You can always start at hca.wa.gov and search for Behavioral Health Toolkit. But this is publicly accessible information, and you'll never need a passcode or a secure link or anything to access it. For wellness coordinators, how you use this toolkit is going to depend on how your wellness program is structured. Maybe you have a network of champions who you want to make aware of these resources so they can promote behavioral health in their work groups. Maybe you have a robust intranet or platform that you want to highlight these benefits on. If we're talking about benefits administrators, you can use these materials on your website, new employee resources. If you still use physical folders or welcome packets, you're of course welcome to print these. Or during annual open enrollment, anywhere you post other benefit information, this is helpful. You can help people recognize the importance of mental health by elevating behavioral health benefit information to the same level as medical, dental, vision, etc. For other roles, it depends. Maybe you have a role in training and you want to use the glossary or FAQs for an in-service focused on mental health. Maybe you're an office manager with a passion for mental health and you want to include a glossary term once a month in an email bulletin that goes out to your work group. Or maybe your role isn't related at all to well-being or employee care, but you are a mental health advocate and you want to lower stigma by hanging a poster on your door. Use your best judgment and don't hesitate to reach out if you do have questions. So we'll take a moment here to check on the chat to see if there's any questions that we can answer live. You are always welcome if your question wasn't addressed here or if something comes to mind later on, feel free to email Washington Wellness, WA wellness at hca.wa.gov, and I'll either answer that question for you or pass it along to the appropriate person to get that addressed.